Welcome to our podcast. Today, we're diving into a topic that affects millions, angina or chest pain. Let's start with the basics. What exactly is angina?
Angina is actually a symptom, not a disease itself. It's that uncomfortable chest pain or pressure when your heart isn't getting enough oxygen-rich blood.
So it's like your heart's way of saying, hey, I need more fuel. But what does that pain feel like? Is it always sharp?
Not necessarily. It can be pressure, squeezing, fullness, or even a burning sensation. Some people even mistake it for indigestion or heartburn.
That's interesting. I've heard that angina can sometimes show up as pain in the arms, neck, or even the jaw. Is that right?
Absolutely. The pain can radiate. Sometimes people feel it in their shoulders, back, or jaw. It's sneaky. Definitely not always just in the chest.
And what's going on in the body when someone feels angina?
It usually means the coronary arteries have narrowed due to plaque buildup, which limits blood flow to the heart, especially during activity or stress.
So if I'm running to catch a bus and suddenly feel chest pain, that could be angina?
Exactly. Physical activity or emotional stress can trigger angina because your heart needs more oxygen, but the narrowed arteries can't deliver enough.
And when you rest, the pain goes away because your heart's demand for oxygen drops. That's called stable angina, right?
Right. Stable angina is predictable, but there's also unstable angina, which is more dangerous and can happen even at rest.
That sounds scary. How can someone tell the difference between stable and unstable angina?
Unstable angina is less predictable, lasts longer, and might not go away with rest. It's a red flag for a possible heart attack.
So if someone experiences chest pain that doesn't go away with rest, they should get help immediately?
Definitely. That's an emergency. Call 911 or emergency services right away. Time is muscle, as cardiologists say.
That's a memorable phrase. Are there other types of angina besides stable and unstable?
Yes, there's also variant or Prinz-Metals angina. It's rare and happens when a spasm suddenly narrows a coronary artery.
Does that kind of angina happen during exercise too?
Not always. Variant angina often strikes at rest, sometimes at night. It's linked to temporary spasms rather than blockages.
Interesting. So what are some risk factors for developing angina?
The big ones are high blood pressure, high cholesterol, smoking, diabetes, obesity, and a sedentary lifestyle.
Sounds like the usual suspects in heart disease. Genetics must play a role too, right?
Absolutely. Family history matters. If heart disease runs in your family, your risk for angina goes up.
How do doctors diagnose angina? It seems tricky since symptoms can be vague.
They start with a physical exam and detailed medical history, then may order tests like an EKG, stress test, or coronary angiography.
I've seen stress tests on TV, people running on treadmills with wires attached. Is that what it's like?
Pretty much. They monitor your heart's response to exercise, looking for signs of reduced blood flow.
Once diagnosed, how is angina managed? Is it just about taking medication?
Medications are a big part. Things like nitroglycerin to relieve pain, beta blockers, or statins. But lifestyle changes are equally important.
So, eating healthier and staying active can really make a difference?
Absolutely. Quitting smoking, exercising, managing stress, and eating a heart-healthy diet are key steps.
And what about severe cases? Are there procedures to help?
Yes, sometimes people need angioplasty or even coronary artery bypass surgery to restore blood flow.
That sounds intense, but I guess those procedures can be life-saving.
Totally. They're usually for people whose angina isn't controlled with meds and lifestyle changes.
Can angina be completely cured, or is it more about management?
It's usually about management, but with the right treatment, many people lead active, fulfilling lives.
That's reassuring. Are there any warning signs that angina is getting worse?
Yes, pain at rest, longer-lasting pain, or pain that's more frequent should all be taken seriously.
And always call emergency services if you suspect a heart attack. Better safe than sorry.
Exactly. It's not the time to tough it out. Getting help quickly can save heart muscle and lives.
Are there any myths about angina you've come across?
One is that only older men get it. In reality, women and younger people can have angina too, though symptoms might be different.
Right? I've heard women's symptoms can be more subtle, like nausea or fatigue instead of classic chest pain.
True. That's why it's important not to dismiss unusual discomfort. If something feels off, get it checked.
What about people who think it's just heartburn or anxiety? Is that common?
Very common. Many dismiss their symptoms, assuming it's not serious, but it's better to be cautious when it comes to your heart.
Makes sense. And after a diagnosis, is it important to follow up regularly with a doctor?
Yes, regular checkups help adjust treatment and catch any changes early. It's a partnership between patient and doctor.
So, to wrap up, angina is a warning light, not to be ignored. Managing risk factors and seeking help promptly can make a huge difference.
Exactly. And if you're ever unsure, don't hesitate to get checked out. Your heart will thank you.
Thanks for joining us today. We hope this conversation helps shed light on angina and encourages everyone to take heart health seriously.
Absolutely. Stay active, eat well, and listen to your body. Until next time, take care of your heart.